Good morning, good evening, good afternoon. This is Dr. Garais, your professor for MED210, Tuesday morning, term 2, but it could be any term. I put some notes in. The two types of notes that I put in are the skeletal system notes and the joints, and a lot of it is based on the video, so you can watch the videos, but I just wanted to put it in a little more organized format as per my other notes and things of that matter. So when we're looking at every system, one of the first things that we always look at is um, what what is the function. So of course your bones or your skeletons, they're support. You wouldn't be able to think of pathology. If you broke a bone, can you stand up? Even if you broke your hand, it's difficult to stand up. It's difficult to move around. It's difficult to protect yourself. So those are the three obvious ones: support, protection, movement. And again, you can see how the skeletal system is directly linked and directly related to the muscular system. So if I broke your arm, you still couldn't move your arm. Or if you had a muscle issue with your arm, your bicep or your tricep, you still can't move your arm. So remember, even though we study these systems like separately, do know and understand that our connections, everything's connected to everything. Now, another thing that bones have, bones are living, breathing things, and we're gonna show you that in a moment. But they have minerals in it, calcium, phosphate, and these, and it has also electrolytes in it. So it also deals with electrolyte balance. It also deals with acid base balance because it is the source of calcium carbonate. And carbonate is a buffer, which is a weak base. So if you become acidic, your bones will release a little bit of calcium carbonate. Now, what makes bones hard and for your protective and movement and support functions is a process called calcification. And there's these minerals, and we know minerals that come from the ground, they're rocks. So specifically, calcium and phosphate. Without those two things, and again, you could go back to pathology. Let's say, for example, in osteoporosis, you start leaking out calcium out of your bones become weak, right? So that's the overall functions of your bones. They have storage for minerals that gives it its strength, and do know and also understand that your cartilage it has a similar makeup, but they have far less calcium and phosphate. And last but not least, I'm going to be showing you the cross section of a bone momentarily. But inside bone, you have red marrow and you have yellow marrow. The yellow marrow has a lot of fat, and the red marrow has a lot of blood. And the bones, they are sources of blood, hence the term hematopoiesis. If you recall your medical terminology, it's the production of hemat, or blood. So if I break a bone, what are the two things that are going to leak out immediately? Blood and fat and minerals, right? Oh, well, that's three things, but you get how to look at pathology. You look at normal and you mess with normal. So let's look at general features of a bone. So we could look up types of bone. I could Google that. Let's see a nice image here. Here's a nice picture here. And if I'm looking at it, looking at bone could be separated into various classifications. And one of those classifications is shapes. So the types of bones. And here we go. So let's look at the easy ones, which is long. And those are usually part of your appendicular skeletal system, which are your legs and your arms. And you could say, obviously, they're long. Now, if you look at your wrist and your ankles, they can be classified as short. Your kneecap or your patella looks like a seed, a sesame seed, so it's called sesamoid. Oid meaning, remember your suffix of medical terminology, resembling, so it's resembling a seed. Now, this is your calvarium or your skull. And if you look at your skull, it kind of looks like a pancake that got molded into a bowl. And that's considered flat. Okay? And then you have the irregular types like your hips and your vertebrae. So let's look up another type of bones, another type of system, or system of classification. Right here, it's easy to look at. My internet was cooperating with me. So the appendicular skeletal system is anything that deals with your appendages or your legs or your arms. You'll also notice that your shoulder girdle and your pelvic girdle is part and parcel of your appendicular skeletal system. And you can ask anybody who's ever injured their scapula or their shoulder blade or their collarbone. You know you can't move your arm if either of that is damaged. And anyone who's ever injured their hip also knows you can't walk or stand very well. So that's the appendicular skeletal system. Now the axial skeletal system is your axis, like like a top, like your center part. So that's your skull and your vertebrae and of course your ribs. Okay. Other parts. Those are other notes. Where's my notes? Text edit. That's it. All right. So there's some general features of bone, and let's look at the anatomy of a long bone because it's the most, it's the typical. So let's look at the typical cross section of a long bone. And again, a lot of this is mirrored. I'm going to show you notes and things, but here's one that I always use. I always use this one. And you could see that the bone is actually hollow. Now, how does, let's see if Pinterest is, okay, here we go. Now, you know what? Let's find something else because Pinterest always wants you to sign in. You know what? Labeled. Let's look at certain things. So first, when you look at your long bone, you can see it's made out of both spongy, which is like this bone that has all these little holes, and compact bone. Now, the compact bone is formed by layers and layers of layers of if you've ever looked at a newspaper, if you look at one leaflet of a newspaper, it's not very strong. But if you take the whole entire newspaper and you roll it up really, really tight, it becomes very, very strong. And that's the same concept with the bone. And since it's also spongy, there's a lot of arteries, veins, and nerves that can go in there, right? And here's a better picture of the spongy. See how and it may be spongy, but it also has a lot of scaffolding, also known as trabeculae. So if you look at the bone as a whole, it is actually living, breathing thing. It has arteries, veins, and nerves in it, and it runs up and down these canals. And then you have compact bone, which are formed in layers or lamellar. And then you have a spongy bone, and it's here. And what's in the spongy bone is all the items that we discussed earlier: minerals, vitamins, fat, the bone marrow. Remember, there's two types of bone marrow, red and yellow. You can see the yellow here. Yellow, of course, stores a lot of fat, right, for energy. And we're going to be illustrating why you need all that energy. And of course, red marrow deals with hematopoiesis. And it also explains the reason why, when you eat like oxtail soup or any soup that's got like bones in it, it tastes really delicious because why? It has a lot of salt from the blood and it has a ton of fat from the yellow marrow. You will also see the middle of the shaft of a long bone is called the diaphysis, and the ends are called epiphysis, because epi means on top of. You will also notice, let's see if we can get a little closer. And again, you could search up these things as well. They're common pictures. And look, you can even like quiz yourself. Diaphysis, epiphysis, and you'll see here, remember that not all parts of your skeletal system has to be hard. You also have to have like spongy shock absorber type cartilage that's here on the end, and that's called your epiphyseal cartilage. And you have also here, do you notice here there's like a little line? Well, when you're going, that's called an epiphyseal plate. And that's actually how we can, in forensics, we can identify not only male or female, we could also identify from the bones through the epiphyseal plate age of the patient. Epiphyseal line is formed and solidifies when the patient is an adult. You could also see the different layers, and of course, the most outer layer is the periosteum, and the most inner layer is the endosteum. Okay, and you could easily quiz yourself here. And it's also nice to always quiz yourself because many people who say, I'm not a good test taker, that's not true. You're simply not a good preparer and no one's taught you how to prepare. If you have test anxiety, please give me a call. If you're one of those people like, I study all night and I don't get really, really good grades, then you're doing something wrong. So give me a call for tutoring and for test taking strategies, especially if you have test anxiety. If you're one of those people who say things like, Dr. Garais, I studied all these weeks, I studied every day, by the time the test comes, I draw a blank. That's part and parcel of test anxiety. Now, let's look at this. This is another nice little picture here. Remember I discussed on how the compact bone is compact and compacted and it's run in layers. Each one of these layers are called lamellae, right? Laminar means, if you've had laminar flooring, it's flooring that's created in layers, pressed and glued together. Well, that's what your bone is kind of made of, and that's what makes it strong. And another analogy to this is, take a twig, you can snap it, right? You can break it in half very easily. But put 4 or 5 of those twigs together, you bind them and glue them together, it gets very, very hard to break that twig. And you could see all of these things, this is called the Haversian Canal. There's all these things are interrelated, and wherever you see an artery, you see a vein, you'll see a nerve. And that's why when you break a bone, it hurts a lot, right? So in between the layers, you're going to have osteocytes, and those are your bone cells. And we're going to talk about how your bone is an actual living thing through this thing called remodeling. Now you'll see these little circles or these little twigs, the best way to put it, twigs that got rolled together and glued together. Those are called osteons. Osteons are also known as the functional unit of the bone. So it takes a whole bunch of osteons together, and they form like these twigs that got glued together, and then that forms the compact bone. And then you have your spongy bone here, but you can see that it kind of looks like a sponge. Okay, Haversian canals go up and down, and you could see these other canals that go sideways, and that's your Volkmans. Okay. Alrighty. So those are some nice pictures, and to illustrate that the bone is actually a living thing. Now, remember we talked about on that picture previously, we talked about osteocytes. Those are mature cells. And the lacunae and canaliculi are the little canals, and the little spaces in between where the osteocytes or the mature bone cells rest. Now, this is why the bone is harder than steel and lighter because of the way it's formed. And another cool thing that bone does, especially when you're younger, is that it goes through a lot of what is called remodeling. Let's see if we can get a chart of remodeling. Easier. I like charts. They're easier to show you stuff. I can sit and talk and show you words all day, but okay, here's a nice slide. So this is what happens. Now you have like here's a better one. I'm trying to find a good one. I like the one that I draw in my class, but this is a little bit on the complex side. You don't need to know every little thing, but essentially this is how remodeling works. Let's go back to this one. Should have stuck to this one. Now, because what's going on at any given time, especially when you're younger, is that your bone is remodeling. Re means to do all over again. So your osteocytes, they don't last forever, right? So the first thing that happens, you have these other cells called osteoclasts. They start breaking down the bone and removing all the minerals out of the bone, okay? And then mononuclear cells then do what? Start rebuilding everything. They're rebuilding in order to form new osteoclasts. But before we can, not osteocytes, but before we can do that, we have to make osteoblasts. Now, anything blast cell is an immature cell. It doesn't do much yet, right? And then it goes, and then it makes into osteoblasts, then eventually turn into osteocytes, which is mature cells. And then what happens? There's certain little damage, and then it gets resorbed again, then it builds up again. And it's this constant cycle between osteocytes, mature blood cells, osteoclasts, break things down, osteoblasts, grow things back up, right? And then back to osteocytes. So it's like this, it's this constant cycle of regrowth and remodeling. And that's why your bones are stronger than steel. Because if you bend steel, it's bent, right? You break it, you break it. But in human bone, and again, back to especially when you're younger, because those of us who are a little bit older know that stuff not only hurts, but if you fall down the stairs in your 50s, it's very different than when you fell down your stairs when you were a teenager. And we all know that. And now you know why. because when you get older, the amount of resorption or osteoclast breakdown of bone and bone material is greater than the formation or buildup of osteoblast. And this is kind of how I remember it. Blast, it was a blast to be young, so osteoblast is the immature cell, osteocyte, mature cell, osteoclast, or I hear the word class or crash, it sounds like it's breaking down. And that is bone remodeling. All right, let's go back to our notes. Okay, so those are the osteoprogenitor cells or bone stem cells, immature cells, osteoblast. Osteocytes are the mature cells, osteoclasts are the cells that break down. We already talked about lamellae, endosteum, periosteum, the osteon, the different types of bone marrow, hematopoiesis, classification, don't go much into, you can look up the effects of pressure on bone development. Basically, Wolff's Law goes like this. You need exercise and gravity to promote bone growth. If you recall, like any space station, when astronauts are up there for way too long of a time, they start having massive amounts of bone resorption. That means there's way too many osteoclasts that are breaking everything down, because the human body, if you don't use it, you lose it. Ask anyone who's ever been in a hospital for a couple of days and who's been sitting in bed for a couple of days. It's really tough to get out of the bed. You lose a lot. You lose some muscle mass. You will also lose some bone density as well. That's why, especially in assisted living situations or your geriatric patients, we're always promoting some mild to moderate exercise. Again, too much of a good thing. Too much exercise, of course, you can hurt your bones. That is also a proven fact for people who are runners. Remember we talked about the epiphyseal cartilage. That stuff on runners almost wears away. That's why they have a lot of joint and knee problems and lower back problems, even though they're relatively pretty healthy. Again, moderation. We talked about calcium, phosphates, this stuff. I don't know why I talked about that stuff before, but I don't find too relevant now. But this right here, calcium homeostasis, look it up. Look at a video, but the way your calcium release and absorption is controlled in your bones is through calcitriol, calcitonin, and parathyroid hormone. And calcitriol, of course, that's why you're always talking about vitamin D. Its function is to increase blood calcium. So if calcitriol is in your blood, what will it do? Increase of calcium in your small intestines, increased bone resorption from your bones. Okay? And kidneys, there's some minor effects from your kidneys. Calcitonin, they're created in your C cells, near your thyroid gland, in your throat, your cervical area, and it's an osteoclast inhibitor. So what will it do? If your bone isn't breaking down, neither is calcium getting released, right? And also it's an osteoblast stimulator, which will do what? Take whatever calcium you have and build up. And of course it makes sense, calcitonin is found more in children than in adults, because you don't have much osteoclast activity going on when you're a kid. There's no really need for breakdown unless there's damage, right? And osteoblast stimulator, of course, kids got to grow, right? Now, PTH is parathyroid hormone, and what is its overall? It increases calcium. So your parathyroid is located right under your thyroid, in your neck, and what will it do? Of course, if you want to increase calcium, what do you need to do? Increase the increase the osteoblasts? No, I think that's backwards. I think it's easy, promotes osteoclasts. Kind of correct that, please, in your notes. And of course, calcium, well, maybe, wait a minute. Parathyroid hormone increases hormone. So osteoblast, increased bone resorption. I think it's osteoclast because I we got to check that. I think that might be a mistake. Calcium reabsorption is kidneys and inhibits bone deposition. All right. So I think this is osteoclast because increased bone resorption is osteoclast, not osteoblast. Phosphate homeostasis. It's not as exciting or as regulated as calcium. Those three hormones are really big. And the big question usually on exams is usually does it increase or does it decrease calcium? Calcitriol also increases phosphate levels, and remember, increased phosphate levels increase osteoblast activity. It'll create more bone. It'll create more strength. Other factors: testosterone, estrogen, and I also mentioned gravity and exercise, um, and also like moderate levels of trauma. Because if someone who plays football a lot, or plays a sport that's kind of rough, there's going to be a little bit more bone deposition. I remember recalling a study about 20 years ago. They were wondering why all these like Chinese kids who studied martial arts, they had bone densities, they had greater bone densities than European children, and it's because why? They're training, and when they train, what do? They get hit in the head a lot. They also, if you've seen anyone who's practiced martial arts, look at their knuckles, look at their forearms. There's a lot there's a lot of little minor deformity, but that deformity is to do what? Increase bone deposition, to protect the hands, to protect the skull. And we already know adolescent growth, greater effects of growth hormone, especially during puberty age. Okay, yellow marrow, epiphyseal line, epiphyseal plate. All right, and that's pretty much the notes. Look for the skeletal system. Please also look at the videos, and they're related. In the videos, there are certain parts of the videos that go a little bit in greater detail. Now let's look at some of the items regarding joints. There are three kinds of joints, and if you look here, now what are joints? Joints are articulations or any place where two bones meet. Arthrology, study of joints. Kinesiology is kinetic science or kinesthetic science. I've seen it called kinetic science. It's the way you move. Physical therapy laboratories, a lot of them are called kinesiology laboratories. Kinesiosynthetics. There's a whole bunch of these new age and new wave terms, but it all means the same thing: movement. Now, if the bones are good, that's wonderful. If the muscles are good, that's wonderful. But now I'm at the age where I now have arthritis, inflammation, infection of my joints. How's my movement? Not as good as it was, of course, when I was younger. And here are the three main categories of joints. So you have ones that are totally not movable or immovable. That's your synarthrosis. Syn means the same. So the joint, the bone on the left and the bone on the right, or the bone above and the bone below, will not move. And here are some examples. And the classic is the suture lines in your skull. If you look at your skull, if you recall when you were a baby, or maybe some of you had children, there was soft spots, right? Well, when you get the soft spots are there, so you allow for your brain to grow and your head to grow. Now, when you get older and older, what happens? The skull starts what? Solidifying, and those parts of the skull form these suture lines. Let's look at the sutures. So you see this? Skull of newborn, there's going to be spaces. And those are called your fontanelles. But as you grow older, what happens? They start doing what? Now, the two bones are synarthrotic. They're the same. They form these sutures. And eventually you're going to have to know what all these sutures are, what all these bones are. So you have the frontal bone and your parietal bone. right? And it's separated by the coronal suture. You have your temporal bone and your parietal bone separated to squamosal. I'm saying that right. And then, of course, your lambdoidal, because in the back, right, your occipital bone forms a delta or a lambda or a triangle shape. Okay? So those are sutures, and they are immovable. Now you have amphiarthrosis, or slightly movable. So like your tib fib or your tibula fibula, your pubic symphysis, and your costal cartilage. Let's look at amphiarthrosis joints. Some examples. Let's see. I want pictures. Now, the amphiarthrotic joints, like here in your vertebral column, this is your intervertebral disc or IV disc. It's in between different vertebrae, and these are your lumbar vertebrae. They don't move. They don't move that much. So they're amphiarthrotic. Versus, oh, here's another amphiarthrotic. You can see here, your rib cage shouldn't move that much because yeah, you're breathing, but your chest shouldn't, pop out way beyond your belt. So those are slightly movable, right? Oh, Quizlet is really nice to mess with. Now, if I'm looking for, so let's look at what we have so far. Synarthrosis, right? Totally immovable. Do not move. Amphiarthrosis, your pubic symphysis or your costal cartilage in your ribs, your tibula and your fibula in your lower leg, those are amphiarthrosis. Now, diarthrosis is a synovial joint. That has a full ROM or full range of motion. And the classic model for a synovial joint is your knee. So when we're looking at your knee, here's a nice thing. Of course, here's your patella. You'll see here, there's little cavities there. And these are both two epiphyses of bone. One's your femur, one's your tibia, and then there will be cartilage in between here. There's ligament here, and that's your ACL. And then you have your posterior cruciate ligament, PCL, anterior cruciate ligament. I already said that, ACL. You also have these little pockets, and this is a cavity for fluid. The fluid is called synovial fluid. That's what makes, if that stuff's clear and clean, that's what makes your joints move quite freely. Now, when you get older, of course, these ligaments start to tear and wear. The cartilage here starts to rub and tear, and of course, there's less and less synovial fluid, and even sometimes this bursa or this pocket can get inflamed or infected, and then you get bursitis. Anything that messes with this, the joint space, is called an arthritis, and multiple types of arthritis are called arthritides. Okay? All right, I guess that's it regarding the joints, different kind of joints. Let's look at what I wrote here regarding synovial fluid. Okay, it also has nutrients, it removes waste, forgot to talk about that. It's always constantly flowing, and it flows a lot better when you're younger. You see kind of like there's a pattern here, but again, like I stated, if you don't use it, you lose it. So if you lead a sedentary lifestyle, all of these pathologies that I'm talking about will get to you quicker. But people who have moderate exercise, have been proven to be able to move better. There's a study that I read a while back, it had to be more than 15 years ago, where uh, they were wondering. They did multiple studies on the Japanese people because they live a long, long time. And one of the aspects of one study that I read is that they created some sort of index on a person's ability to lie on the floor and get back up, get down on the floor and get back up, and they timed it. And people who have better cardiovascular, better joint, better musculoskeletal, better weight can get up off the floor faster. And I'm also finding that true. Lately, I've been struggling with my weight, and I'm finding it very hard to pick up stuff off the floor. Or if I have to pick up the kids' toys and I got to get on it on my knee, it becomes really difficult because you don't use it, you lose it. And I am definitely live a sedentary lifestyle where I'm pretty much in front of a computer all day. But if I want to keep on getting healthy, that's got to change. Um, Another thing that it does, along with the epiphyseal cartilage, it's also a shark absorber, right? So there's fat pads, there's also ligaments, which are bone connecting to bone. And last lecture we talked about tendons, which is muscle connecting to bone. Now remember, ligament damage or tendonitis, like strain or a sprain, they both have similar effects. So your patient can't move too much. There's going to be signs and symptoms of localized trauma and or inflammation or infection. But laypersons use the words strain and sprain interchangeably, but technically a strain is an overstretching of your tendon, which is the connection between muscle to bone, and a sprain is a overstretching of the ligaments, which is bone to bone. Okay? Now, another real quick thing is a nice little review of your medical terminology. I recall it was like chapter 2 or 3, week 2 of your medical terminology class. Just review the words extension versus flexion, adduction versus abduction, circumduction, pronation versus supination, and especially in your medical clinical careers, you should need to know that. And I'm not going to go over that right now because, in theory, you should already know how to do that. All right, that's all I have notes wise, and I'm going. I don't think I need to make a video regarding what's due, and because we're already at week 6, so I'm gonna leave you guys for now. And if you have any questions regarding any of the videos, and also report to me because I'm getting some sporadic reports like links don't work or the video doesn't work. So I can put on the announcements, or maybe it's your computer system or your server, whatever the case may be. I can get you an alternative video or an alternative picture or photograph or diagram. Okay? All right, that is all for now. Thank you very much.